All right, today we're going to talk about something that's, well, it's a bit sensitive, but it's way more common than you might think. We're diving into honeymoon impotence. It's a topic that's just wrapped up in pressure and anxiety. But as you're about to see, it's completely understandable and, even more importantly, it's highly treatable. So let's get into it.
Really, it all boils down to this one question. Think about it. The wedding night has so much built up around it, all these cultural and personal expectations. But what happens when all that pressure smacks right into the very real stress and just pure exhaustion of a wedding? Well, you get a perfect storm for anxiety, and that can directly affect, performance.
So what are we actually talking about here? The clinical term is honeymoon impotence. You might also hear it called first night syndrome. The two words I really want you to focus on here are temporary and situational. This is not some long-term medical problem. It's a very specific response to the unique pressures of starting a marriage, and it usually affects men who've never had any issues before.
Now you might be thinking, it's just a case of nerves, right? But the story is actually a lot more complex than that. The causes go a bit deeper, and believe it or not, some of them are surprisingly physical.
Okay, this is where things get really interesting. For the longest time, everyone just thought this was purely a psychological issue. And you can see, things like anxiety and stress, they are the main driver in about 72% of cases. So yeah, a huge piece of the puzzle. But, and this is a big but, groundbreaking research found that for almost a third of men, there's an actual physical or vascular issue going on that's related to blood flow.
Let's just look at those psychological drivers for a second. It's really a potent mix. You've got this intense performance anxiety, this fear of failure. You're completely drained from the wedding itself. Then there's all this cultural pressure for the night to be perfect. And layered on top of all of that is this deep personal fear of disappointing your new partner. It's a lot, especially in situations where there isn't much prior sexual experience. Even just a lack of knowledge can create a ton of anxiety.
This right here, this was a total game changer in understanding this condition. A really important study back in 2001 was the first to prove that a pretty big chunk of cases, we're talking up to 28%, had a physical vascular cause. That discovery just completely changed the game for how this is diagnosed and, more importantly, how it's treated.
And this is a really crucial point. This is not just one person's problem. It creates this ripple effect. It becomes a challenge that a couple really has to face and navigate together. Let's take a look at how that dynamic actually plays out. This is the feedback loop that can make things so tough. So it starts with one difficult experience, just one. But that single event then creates intense anxiety for the next time, which, of course, makes it more likely to happen again. The partner, in the meantime, might start to feel confused, maybe even rejected or anxious themselves, and that just adds even more pressure to the whole situation. And so the cycle continues, with anxiety just feeding more anxiety.
And, it's not a one-way street. Studies have shown a really clear link between this and a partner's own sexual challenges, like vaginismus, which is an involuntary tensing of muscles that can make intercourse painful. Basically, one person's anxiety can literally trigger or make the other's worse, creating this shared problem that needs a shared solution.
Okay, but here's the most important part of this entire explainer. There is a clear and very hopeful path to recovery. I want to be really clear about this. This condition is overwhelmingly treatable.
Treatment is not a one-size-fits-all thing, and this is exactly why that discovery of a physical cause was so important. If the root of the problem is psychological, the best approach is usually a combination of some short-term medication and sex therapy, all focused on just breaking that anxiety cycle. But if the cause is physical, vasculogenic, then medication that directly improves blood flow is usually the way to go.
For most cases, the ones rooted in psychology, the solutions are actually incredibly empowering. It all comes down to open and honest communication. Getting some good sex education to get rid of any myths, using things like relaxation and mindfulness techniques, and couples counseling can be amazing for helping to take that pressure of performance off the table. Medication is often part of it, but think of it as a short-term tool, a way to build confidence and break that vicious cycle we were just looking at.
And the recovery? It's remarkably fast. I mean, just look at these numbers. Within a single month, more than 3/4 of patients are able to stop their medication. And within a year, for the guys with psychogenic causes, that number shoots up to an incredible 96%. This just proves that the treatment is meant to be a temporary bridge, not a lifelong dependency.
So as we start to wrap up here, what are the most important things to take away from all this? Well, the key messages are actually incredibly reassuring.
I just want you to look at this number for a second. 96%.
That is the overall success rate for treating honeymoon impotence. It doesn't matter if the cause is psychological or physical. It is one of the most treatable forms of sexual dysfunction out there. With the right diagnosis and the right approach, success is basically the expectation, not the exception.
And here's one more powerful number to leave you with: 85%.
That is the percentage of men who, after a short course of treatment, get back to full, spontaneous function without any medication at all. This right here is the ultimate proof that for the huge majority of people, this is just a temporary hurdle. It is not a permanent state.
And you know, all this leads to a final thought. We put so much pressure on a single physical act. But what this whole issue really shows us is that maybe the real foundation of intimacy isn't about performance or consummation at all. Maybe it's about the courage to have an open, honest, and supportive conversation.